The World Health Organization has stated its commitment to collaborate with the bodies like Synagogue Church of All Nations to advance the war against coronavirus. WHO ready to work with Pastor T.B Joshua to fight COVID-19. The decision was revealed after a Cameroonian medical doctor, Kamani Perry, claimed to have been healed of COVID-19 by T.B Joshua through his church channel Emmanuel TV. In a video released, Dr. Pierre, a gynecologist, said he was suffering from COVID-19 and was in isolation in a hospital ward when he called in the video to receive prayer during an interactive program on Emmanuel TV. He displayed his COVID-19 positive medical report, and while receiving the prayer from Joshua, he vomited out the disease. Days later, he held up the medical report confirming that he was diagnosed negative to COVID-19. However, the WHO Director General Dr. Tedros, WHO Executive Director of Health Emergencies Dr. Michael Ryan, and other WHO officials were questioned about the miracle by Cameroonian journalist Simon Atiba during an interactive media section on July 1st, 2020. The question was like this. On Monday, a very popular pastor in Nigeria, T.B. Joshua, released a video of a medical doctor in Cameroon who was said to have been cured with the virus through prayer. Responding, Dr. Ryan affirmed the readiness of WHO to work with the faith-based organizations to eradicate the COVID-19. Reacting to WHO, Dr. Tedros also added that faith and science should go together. He said, "We know many religious leaders who would really advise their followers to follow their faith and at the same time use science. The two do not contradict, they go together. We will call on all religious leaders to be in this fight and save lives." So here is the video of the WHO response when the journalist asked about the Pastor T.B. Joshua's coronavirus fight. If you are new to the channel, please subscribe the channel and stay connected and watching.
Okay, thank you for taking my question. My name is Simon Ateba from Today News Africa in Washington, D.C. As the number of cases in Africa continues to increase, we have like 400,000 people who have been infected so far, and over 10,000 fatalities have been recorded. We are beginning to see many people claiming that they have a way of curing the disease using non-traditional methods. For instance, on Monday, a very popular pastor in Nigeria, T.B. Joshua, released a video of a medical doctor in Cameroon who was said to have been cured of the virus through prayers. I was wondering, in the context of infodemics, how does WHO react to this influx of information coming from non-traditional sources and from pastors and from people who are not maybe in the medical field claiming that they have a way of curing the disease? Thank you.
Yeah, it's important we make the distinction between claims of disease cure and good acts that support communities in terms of the suffering they go through. And certainly spiritual leadership at a time like this is very important in communities, whatever the faith. And therefore we respect and have worked very closely with faith-based organisations on the huge contribution they are and can make to managing anxieties at community level, providing direct support to communities coping with this disease, dealing with bereaved families and individuals. So the role that faith-based organisations play is very important. They also play a very important role in getting good information to people. Sometimes it's projected as a route of misinformation. In fact, we find that faith-based organisations are a very effective way of passing good information, because faith-based organisations are very often trusted by communities. They're a different channel, and we're working very, very closely with those organisations around the world. In fact, this week at the pre-conference on the WHO Epidemiology Conference, I think we had over more than 10,000 connections to that conference. In fact, I think today on the research side we have 1,000 connections into that. So you can see there's a massive hunger and there's a massive commitment to the positive management of information around this pandemic. And we're working very hard with our partners in the tech industry, our partners in the communications and social sciences, and other UN organisations to do that. So faith-based organisations are a very important part of this response. With regard to claims of traditional methods or healing, we've seen that traditional, in many different diseases, effective therapies have been found through the examination of traditional products and other things. There are products out there that can enhance health and well-being, and obviously we should healthy diet and supplementing our diet with appropriate products is a very important part of being healthy. Specifically though, when it comes to making claims around cures for products, we have to be very, very careful. We want to make sure that all products that show promise in the care or cure of individuals with COVID-19 go through and go into properly managed trials, so we can see what their impact and their effectiveness is. It is impossible to determine the effectiveness of any drug or any traditional product unless we are put it through the rigours of a properly controlled trial. That is the same whether it's a product developed by the pharmaceutical industry or a product developed by traditional methods. As I said, many drugs and many effective things have been found through traditional approaches. So traditional medicine is very important to communities around the world, and therefore WHO has an initiative on traditional medicine. We look on traditional medicine in a very, very, very positive way. But it is also, as I said, extremely important that any promising therapy go through the proper testing for safety and efficacy, so we can all support such products if they are found to be effective. Maria?
Just quickly to add on the information, so as you've pointed out, there's a huge amount of information that's out there, not only for COVID, but for different cures or for every element of this pandemic. And as Mike has said, we have a conference that's ongoing right now on this infodemiology of how do we manage all of this information. We're not set up to absorb this much information all the time. So how do we tease out the good information from the misinformation, from the disinformation? Because there's information that's out there that's not quite right, and it needs to be corrected. And so we work very hard with different platforms. We put out these myth busters where we directly head-on say, this one isn't quite right, this is wrong, here's the right information. But there's also information that's out there that's willingly wrong. And that could be incredibly dangerous, and it could put people in harm's way. And so we're working also to ensure that the information that's out there that is not harmful, and that anything that's out there that is purposefully wrong, we address. Faith-based leaders are incredibly important in this, and as Mike has said, we work with faith-based leaders across the globe. We work with different travel and tourism industries. We work with the civil sector. We work with scientists and public health professionals. We work with journalists. Journalists also have a role to play in getting good information out, having fair and balanced reports, and we're so grateful for these articles that come out that explain very complex topics and put it into the context of how we can help people suppress transmission and save lives. So we welcome the partnership with journalists on that. And we work with individuals. Everyone on the planet is part of this response. Every single person. And everyone needs to know that they have a role to play in this, not only from protecting themselves from getting infected, but preventing the onward transmission to their loved ones, to someone who potentially is vulnerable that could develop severe disease. So you have a role to play in also not ensuring that you don't pass on poor information. Go to good sources. You can always come to WHO, but there are ministries of health, there are hotlines, there are reliable sources of information. So please choose your information carefully, and please be conscious about the information that you pass onwards.
Maybe I would like to add on this issue. I remember this is during the HIV/AIDS era at its peak. And we started using medicines, and some patients were using some medicines. And there was same situation like what we're seeing now, where people were forced to choose between the medicine and faith. And I remember religious leaders, we discussed with religious leaders, and religious leaders going to their followers saying, the two can go together. Have your faith, continue to take your medicine. That's what we advise you. And that really resolved the situation. And we know, as what Mike said, many religious leaders who would really advise their followers to follow their faith, but at the same time use science. The two do not contradict. They go together. So that's our advice, and we would call on all religious leaders to be in this fight and save lives. Thank you.
Thank you, Dr. Tedros. And the very last